this first one, it's actually really difficult to do this sitting up unless you have really flexible hamstrings, which most people don't. So you can do it lying down, or you could have an elevated surface, and you're gonna do a quad set. And what that is you're gonna tighten your thigh muscle like you're pushing your knee down into the table. And the best way to think of it is I want you to envision you're pulling your kneecap up. So I don't know if you can see this very well, but I'm gonna squeeze, and you might even flex your foot, and then you would release. So watch my thigh muscle, squeeze, and release. Next one is called a hamstring stretch. You're gonna take either a strap, a dog leash, or a towel, a belt, put it around your foot. You're gonna lie down. This one has little handles, but if yours doesn't, you can just choke up a little bit at a time. You're gonna bring your leg up until you feel a stretch, wherever that is for you, with your knee straight. If you can't keep your knee straight and you're doing this, that's cheating. So your knee is straight. If you want to add this, you can add in a foot pump up and down. This will help progress your nerve. This next one is called a heel slide, and the key is in this particular protocol that you only do it up to the edge of pain, not through pain, and that range of motion should improve over time. So a heel slide is just what it sounds like. You're going to slide your heel as far as you can without pain, and then you're going to slide it back out. So on this one, you need to tie the band around something sturdy. This is actually not a good example, but you get the idea. And then you're going to step back with your feet even and your knee bent, and then you're going to push your heel down and straighten your thigh. Bend it forward, push your heel down and straighten. One more time, bend it forward, push your heel down and straighten. The Deyle Protocol is the leg press. If you have access to that as, say, a gym, you would do the leg press in whatever range of motion you can do without pain. Now over time, again, that range of motion will hopefully progress and you can go further and further. This one's called a mini squat, and again, it's based on your tolerated range of motion without pain. If you need to start out with a 2-inch one because that's all you can do without pain, it's fine. But ultimately you want to progress to as far as you can. So you might look, and I tell people it's kind of like you're sitting back over a dirty toilet. So it might start like this, a little teeny baby one, and I have this in case I need it. And then as you get more flexible, you can go lower, okay? Put it here, and then one foot's gonna step back. Oh, don't stick your butt out. Tuck your butt in. There you go. Yep, and just hold it. No bouncing. One of the exercises in the Deyle Protocol is to ride a bicycle. They specifically recommend a recumbent bicycle, and this is all based on a research protocol that was done for patients with knee arthritis. This one you're going to do little mini step-ups. So you're just going to step up and step down, and then switch feet. Step up and step down. You can do this also on the bottom stair of your stairwell. But you just pull it in towards your bum. Your goal is here to keep your knees close together, squeeze your cheeks, and then pull your foot in. But if you can't reach your foot because you've just had a knee replacement, or you don't have enough range of motion, you might not be able to put this strap on like that either. You might have to get up.
All right.
Put the strap on. Bring the strap over your shoulder, okay?
And then push it, pull it.
Yep, except try not to pull your hair.
Yeah.
Yep, and you just keep choking up until you feel a stretch.
Yeah.
That feels really good. If you're a patient at Apex Wellness Providers, this video has been made for you to help assist in your technique for your health and wellness journey. If you're not a patient, please use this for educational and entertainment purposes and is never a substitute for your own individual medical advice.